That's all.
All right. Mic check. Testing 3, 2, 1. 3, 2, 1, 3, 2, 1. 3. Okay. All right, go ahead. Yeah, close up.
And everyone, thank you for joining us today. I'm Britton Kinney. I'm the Public Information Officer for Gaston County DHHS. Also in the room with me is Steve Eaton, our Public Health Director, and Dr. Kim Eagle, our County Manager. Steve will start out today talking about COVID-19 and an update for our community, and then I'll be speaking about our new Gaston Saves campaign, and then Dr. Eagle will talk about some local initiatives for our community. So I'll turn it over to Steve.
Good afternoon. I'm Steve Eaton. I'm the Public Health Director for Gaston County Department of Health and Human Services. And I'm here today to provide an update on COVID-19, where we are as a community, and a few encouraging reminders for our community as we head into this holiday season and weekend. First of all, I have some good news to report. Our numbers are trending down. Our hospitalizations are trending down, and we're seeing fewer COVID-related deaths. In July, when we came and asked the community for your help, our community clearly heard us, listened to us, and because of that, and because of their actions and compassion, we're seeing things moving in the right direction. This is certainly good news for us and for our community. But as we see things stabilize, we have to remain diligent as a community, especially heading into a holiday weekend. Our percentage of positive tests remains higher than where we would like to see it. Our goal is to be below 5%, and currently we trend around 10 to 11% of our tests coming back positive. We're also seeing our local numbers of testing coming down. We want people to get tested if they have symptoms or are concerned that they have COVID. We want people to get tested if they are in contact with someone with COVID, or even if they're not having symptoms, because we know asymptomatic people can spread the virus, and knowing if somebody is positive is very important to slowing the spread. All of this will help us keep from infecting each other and others in our schools, nursing homes, and businesses, all of whom are working so hard to keep safe. So a few important reminders going into this weekend. First, by now we all know the 3 W's very, very well. We have to continue utilizing these practices as a community. Wear your mask, wash your hands, and wait 6 feet apart. Thank you to all of those who have been caring for our community by doing this, and we want to continue to slow this spread by doing so. This is also about making simple, everyday decisions. Staying at home if you're starting to feel as if you're sick. Deciding not to attend a party where you may be exposed or expose others. Isolating yourself while you're awaiting your test results. Everyday decisions we make have an impact on us, our families, our co-workers and friends, but also on the entire community, our businesses and schools, and our ability to manage this together as a community. Gaston County is resilient, and you're making a difference, and it's showing, but let's keep working together to slow the spread. We're very excited about some work that's been happening behind the scenes to remind our community how to fight and face COVID together. And I'm now going to turn it over to Britton Kinney, our Public Information Officer, to talk about the new Gaston Saves campaign.
Thank you. So again, good afternoon. I'm Britton Kinney, our Public Information Officer, and we are very excited today to announce the launch of Gaston Saves and Mask Together campaigns. We know Gaston County is a community that cares deeply about one another, about our friends, our families, and our businesses. Gaston Saves is dedicated to turning this compassion into action to save lives. This afternoon, we are launching a new website, gastonsaves.com, that will promote community safety and education to at-risk populations throughout our county. SAVES stands for Safety Awareness and Vital Emergency Support. The ultimate goal of the Gaston Saves is to save lives and reduce the impact of crises like the COVID pandemic. While the site will initially be focused around COVID, it will continue to provide county residents guidance, information, and quick access to critical resources in times of emergency. Today, we are also launching Mask Together, a public education campaign and an initiative of Gaston Saves. This campaign aspires to slow the spread of COVID by encouraging our residents to use masks anytime they are in public or around other people. I'll now walk you through the new site and some of the resources that you'll see there. So first you'll see that we are asking Gaston County to mask together for friends, for families, and for businesses. You'll continue to see images and media associated with this campaign throughout the holiday weekend and in the coming weeks. We are especially excited about our mask meter. This has various activities sorted by risk level. And regardless of the risk level, you should always wear a mask whenever you are around others outside of those that you live with. We'd also like to acknowledge there are many considerations when you're considering how risky an activity might be. For example, the size of the space, whether you are indoors or outdoors, the number of people you're around, or whether people are yelling or singing, which might increase the spread of droplets. We also have some of our local data available on the site, and perhaps most importantly, links to many of the critical resources in place for our residents, like testing opportunities or business guidance. The public can join in the fun and show us how they are masking together by using the hashtag Gaston Saves on their Instagram posts, and their images will appear here on the site. Lastly, you can sign up for Gaston Saves email alerts and be the first to know about new resources or other important information. I'll now turn it over to our County Manager, Dr. Kim Eagle, who will be sharing some additional information about local initiatives for our residents.
Thanks, Britton. Today my remarks will be fairly brief. I'm excited to announce as a part of this campaign that we're making face coverings available to anyone in our community who needs them. We're utilizing the library branches. Those will be pickup points, and anyone can stop by and pick up a pack of 5. Those are free of charge, and that will be Monday through Friday. We do not want there to be any barriers for our citizens to access masks as we work together. Keeping everyone safe is critical. You can find the list of participating library branches on the GastonSaves.com website. Additionally, in that very same section, you'll find links to our Small Business Bridge Loan Program, as well as our CARES plan. And it's really important for me to let the public know there's about $300,000 left in each program. For our small businesses that are in need, for our citizens who've been hit really hard, this is extremely important. These funds are still available. They can help with paying rent, they can help with getting food, child care expenses, and those kinds of things. So with that being said, if you have any questions, I'll turn it back over to Britton, and she can facilitate those. Ken, do you have one for me before I step away?
You said $300,000 in each. That means
That's correct.
$300,000 in CARES, $300,000 in small business.
Yes, sir, that's
loan?
correct. Yes, so there's the Small Business Bridge Loan Program, which is a loan up to $5,000 per business. You can make application through the county for that. The second program is the CARES program, where folks can make application that is administered through the Department of Health and Human Services. That's for rent, food expenses, child care, and we're doing those to individuals in the community. Does that help?
That does. How much was allocated to that program in the beginning? Was it $1 million?
I'll have to get you the exact number. Are you speaking to the CARES program specifically? I believe it was $1 million, but I'll confirm that for you. Any other questions for me before I step away? Okay, I'll turn it back over to Britton.
Are there any other questions? Yes, Ken.
Yeah. This one is to Steve. We went through this right after Memorial Day. Is there a concern that we may see Memorial Day repeat, that is 2 weeks afterwards and a sudden explosion?
It's certainly a concern, and I think that's why we're here today, is to, one, let the community know where we are with our numbers, and that we have stabilized, which is very encouraging, but we do know that numbers and trends can change sharply quickly. So we want people to remain really focused and diligent in the 3 Ws over this weekend.
Just wanted to see what you all have been seeing in terms of trends in the schools since they've started. Have things been looking all right? What has that been, your thoughts?
So we've been really pleased with the work of the schools. We work closely with them over the summer and are really pleased with the work that they're doing. They have seen some positives, but when we trace those positives, none of those were contracted or transmitted within the schools. They were from outside the schools. And again, that's why we're here today, is to, again, alert the community that if we're going to protect our schools, protect our congregate living facilities, we really need to, while we're in the community, keep each other safe.
And what, follow up with that, some parents, whenever they see those numbers that, oh, there's a positive case at my child's school, what is the point of being alarmed versus the point of, okay, it's just one case, this is happening?
Yeah.
Concerned.
So again, the schools have their communication protocols in place, and we work closely with them. And again, if parents have concerns, it's good for them to reach out to the schools directly, and they can reach out to us as well. A lot of it is on a case-by-case basis, whether that's within one classroom, whether that's within the entire school, if it's within a grade, and so it can vary. And so as those situations arise, please reach out and ask questions.
Kind of a two-part question. We are holiday weekend, and the word is encouraging people to wear masks. What is the message for people who may feel like they don't need to wear a mask?
So everybody should wear a mask, and especially when you cannot socially distance. So if you're outside, inside, if you feel like you cannot socially distance, it's important to wear a mask. But sometimes we don't know when somebody's going to come up to us, maybe behind us, beside us, and that's why it's important to always wear a mask to keep the other person safe as well as to keep yourself safe.
And the second part, has there been any thought of kind of looking at other counties that were making it not necessarily optional but more mandatory to wear a mask? Is that part of the thought process in the campaign at all?
So right now we've seen really positive results with our community, and our community's working really hard together. So as long as we can continue on that path and keep ourselves and each other safe, I think the message is the 3 Ws right now.
If you can, asymptomatic spread really seems to be the devil here lately, in that the people who have seen this thing, who've seen what they believe is a flattening of curve, believe it's okay to be free, to be without the mask, and they show no symptoms.
Right.
Talk to us about what you're seeing from the inside with asymptomatic spread.
So you're exactly right. That is a concern, is that people who feel no symptoms, feel healthy and fine, could be transmitting the disease to others. And again, that's why the push for wearing a mask, and anytime you're within 6 feet of somebody and practicing the 3 Ws is so critically important, because when you do that, whether you're symptomatic or not, you're slowing the spread. So yeah, that is of concern, but I do feel like the community's getting that message. We are seeing people really focused on the mask, but again, when you head into a holiday weekend and there's large gatherings, again, wear your mask, stay 6 feet apart.
If you can, we know at least about 2 clusters at the campus of Belmont Abbey University. Do we know of any other clusters? Have you guys seen clusters develop around asymptomatic spread, or clusters develop within the county?
So with regards to asymptomatic spread in clusters, I'd have to get back with you and talk with our contact tracers and communicable disease team. But again, I cannot speak highly enough for Belmont Abbey. They have all the systems in place, all the protocols and measures in place, and are working very, very hard. What they've seen with regards to clusters at a college campus is nothing different than, quite frankly, what is occurring on other campuses throughout North Carolina and the nation. We are in constant communication with both Gaston County schools as well as Belmont Abbey weekly, and I'm very pleased with the measures and protocols both have in place.
Outside of Belmont Abbey, with those 2 things, the asymptomatic, do we know how much, can we quantify asymptomatic spread, and can we quantify how much clusters are impacting the numbers we're seeing now?
I don't have the asymptomatic spread numbers in front of me. I can certainly look and get back with you.
And how about the other end, clusters? Do we know, have we seen a lot of clusters in the county?
We have seen some clusters. The clusters with regards to schools and congregate living facilities are available on DHHS's website for the state. So if you're interested in those, those are reported, I believe, Tuesdays and Fridays of each week, and those clusters are publicly notified on that website.
And how other things like gatherings that kind of point to our concern for this weekend, have you seen those?
With our contact tracers, we have been able to look at, you know, whether it's large parties or large gatherings, but they're few and far between. But we have seen them.
As far as the campaign, what is the time frame? Is it until you get a certain percentage or days?
Sure. So we've planned through this fall. What we're going to look at doing is continue to push out this mask together messaging, which you know, Steve spoke to. When we're asking people to wear masks, it's not about protecting you. Well, it's about protecting you, but it's also about protecting everyone around you. It's about protecting your grandparents and your children. We want to see how well that works, and if that continues to be something the community is embracing and listening to. And we'll continue pushing out those messages through the fall. If it's working well, we'll continue to share those messages. If we need to reassess and if there are other things we need to push out, this platform, the Gaston Saves website, will be how we launch additional information.
Okay.
Are there any other questions?
I have two additional comments that I wanted to share with you guys. First of all, related to the fall, we're putting together a task force. You know, we've been very closely linked with the health care system, with Steve's folks throughout the process of managing COVID. But in anticipation of flu season, we're being very intentional and deliberate around how we evolve those conversations and how we work together, anticipating any potential impacts. So that's one thing I wanted to share. The second point I wanted to make is I wanted to thank you all for being here and taking the time, because it's extremely important to us at the county that we get the word out, that we support our community, making the mask available, being a resource, and giving folks that comfort that the county is in support of what everyone's going through. This is extremely difficult on so many different levels, and the nature of county business is to be there for the community and support the community. So thank you for covering this. Yes, sir.
Let me ask you, that task force is a big idea. Talk to me, I know you're in the beginning stages. Talk to me about purpose and talk to me about vision at this point.
So purpose, Ken, to your question concerning the task force for the fall, is to enhance and expand the group that we pulled together since the beginning of COVID, to take into account lessons learned from COVID, to anticipate what we may see as a result of flu season coming upon us, so that we can be in the best position to respond. We will be anticipating what those issues are, what those needs are. We're very hopeful, given the data that we're seeing right now relative to what we may expect with flu season. But we think it's in our best interest as a county and for the community to be proactively positioned to think about the fact that we're entering the fall, we're entering flu season, and COVID is still with us. And what questions do we need to be asking? What partners need to be at the table? What considerations need to be made so that we're positioned as best possible?
And is there, I know sometimes when we do this, we can foresee at least one challenge we know. What is that major challenge coming into the fall, looking at the marriage of what two systems that have been pretty bad on the health system lately?
Well, we want to be intentional and focused, to your point, and to the extent possible anticipate what those challenges might be. We have very frequent and in-depth conversations with our partners at Caramont, with our partners at Contegra, with Steve's folks and Britton leading that charge. So we need to remain vigilant and intentional about how we approach these issues, so that challenges, to your point, don't take us by surprise. So, yeah.
We know that some of them oftentimes during flu season can be supply. Is that something that the health department that you guys have looked at with vaccines for flu?
Well, I can have Steve speak to that in particular, but we monitor very closely our supply of personal protective equipment. We have a great partnership with our emergency management staff here at the county, working with the Caramont folks, working with Steve's folks, trying to support all of the municipalities in the county when it comes to necessary PPE for public safety staff and first responders. So from the standpoint of that supply chain, that's something that we stay very closely on top of. Did you have a specific question about testing supplies or
Vaccine.
vaccine?
Flu
Okay, I'll turn
vaccine.
that over to Steve.
Mhm.
Yeah, great question, Ken. No, we're not hearing supply chain issues when it comes to vaccines with regards to flu. Again, one of the things I do want to circle back on is in flu season, these things are important too. So they not only protect against COVID, but they also, while wearing them, will also help reduce the spread of flu as well, influenza. So again, encouraging people to wear masks, same with hand washing, same with social distancing. All those things can slow the spread of both COVID and flu. So our hopes are, from what they're seeing in the southern hemisphere, is flu is down. A lot of that is because people are wearing masks and maintaining good social distancing. So if we can continue the same strategies that we have, we can reduce the spread of both flu and COVID, because combined, if somebody did contract COVID and flu together, that puts them at greater risk for poor health outcomes.
And if you can, talk to me about that, because I know a lot of people, like myself, will forget to get that shot. Do you think there's going to be a run on vaccines? You think, are you guys anticipating how you handle that now as COVID impacts how people see vaccinations?
Absolutely. So right now we're in the process of getting our within the health department, getting our flu clinic stood up so that it can be done safe, quickly, and efficiently. Also, flu vaccines are available in nearly every pharmacy throughout the community, through your family physician, et cetera. So now is the time to be looking at getting your flu shot.
And my last question that I know of, and that's, I always say that I know of because I may have one, that is in regards to testing. Are we still keeping our testing sites at the same level? Have we ramped down on that? Has that changed, or is it going up? What are we anticipating with availability for testing of COVID?
We have absolutely not ramped down our testing ability or our testing sites and access. If anything, we're constantly trying to find new ways to get out within the community and to make sure that all people, regardless of where they live, regardless of their ability to pay, have access to a test. So testing continues to increase. As I mentioned earlier, we have seen a decrease in individuals seeking a test, and that's not as a result of testing sites being moved or changed. So we're continuing to encourage people to get tested if they think they've been exposed, if they have symptoms, if they think they've been in contact with somebody who's COVID or symptomatic, go get a test.
Well, if there are no more questions, thank you again for being with us today and helping get this information out to the community, and hope y'all all have a nice weekend.